osteoporosis. Well, osteoporosis, basically what it is the loss of bone mass and density brought about by endocrine imbalances and poor metabolism of calcium. So, I myself, when I was working in nursing homes, so many people in the nursing homes have osteoporosis. And sometimes it can be so severe if they turn in bed or if they cough or sneeze or move too abruptly, they can crack ribs or bones. So that's why it's really important to know the facts with osteoporosis, whether it's okay to give somebody a massage or not with that. And people in like third world countries, if they don't get an adequate amount of calcium on a regular basis, they're more prone to having osteoporosis too. So if you know somebody that's just moved to the States and they've been here for not too long and they're older, they could possibly have osteoporosis. So that's why, again, make sure you have a question like this on your health form so you can ask these kind of questions and see how severe it is. And when I worked in the nursing home, I was also a trained medication aide where I would give out medications to people. And one of the major medications I would give out was Tums. It seems weird, but I would give out Tums to the geriatric population, thinking that Tums has calcium. But some people believe just you need the acid and stuff in your stomach and everywhere else to help digest the calcium, but with Tums it helps neutralize that, so you're not technically getting as much then too. And with some of the pills that you get for calcium, the hard thing with that is sometimes they don't totally digest. I mean, even like multivitamins, sometimes they'll show up in even x-rays. You can see the full vitamins. So that's why when I worked in nursing homes, a lot of times we'd crush the medications or at least cut them in halves or fourths or whatever and add it into applesauce or pudding just to make it easier for them to swallow too. But my dad, he was diagnosed with osteoporosis in his early 40s, and he also has degenerative disc disease where the lumbar region is actually deteriorating. And that happened when he was in high school, and he dove off a board and hit the bottom of the pool and with his head, and the impact went to the lumbar region, so that's why he's always had problems in his lower lumbar region. But with osteoporosis, again, there's many different levels of it, so that's why you want to make sure you check on that. And women, when they're going through menopause, they're more likely to develop osteoporosis too. So again, get the facts as much as possible, and again, severe forms, even by coughing or sneezing or rolling over bed, they can break bones. So again, it can be that severe, and not a lot they can do with ribs. They just gotta kind of tape those areas, and hopefully they'll grow back right. Because it's not like if you break your femur or something, it's a little bit easier to set those kind of things. But with ribs and especially clavicles, are sometimes the worst bones, what I've heard. Luckily, I've never broken that bone before then. So, ask questions as much as possible, and leave any kind of comments in the section below. Thank you.